On to one of the most high-yielding topics of FMG, that is the Meniere's disease, also known as the endolymphatic hydrops. The basic pathology behind this is rise in the endolymphatic volume due to poor absorption by the endolymphatic sac. Next, this is most commonly unilateral. Thank God for that. That is unilateral. We will get to know why. It generally occurs in the 3rd to the 4th decade of life. That is the most active period of a human life. That is the 30s and the 40s. Now, most commonly this is in males and the episodic, and it is an episodic disease. That is, it comes and goes. Okay. So there are 3 features in this. Now, any triad or any features are as we all know, are very important stuff for the MCI. So let's concentrate a little on these 3 features. That is the tinnitus, vertigo, and the hearing loss. Now, what is tinnitus? It is the ringing in the ear, and the vertigo is with nausea and vomiting, and there is hearing loss. Now, imagine a 3rd to 4th decade of a male who is going to the office and doing his daily duties, daily job, daily life, how much this is hampered. That is why we said, thank God that it is unilateral, not bilateral. Now imagine if a person is having a bilateral tinnitus, vertigo, and hearing loss. Hence, this is an episodic disease which is of 3 features, that is tinnitus, vertigo, and hearing loss. Now moving on. The episode finishes within 24 hours. Now, some patients fall without turning unconscious during the episode. That is basically known as Tumunkin's crisis. This is important, guys. Falling down without being unconscious. Why? Because there is ringing in the ear, tinnitus, and there is vertigo. So, the balance of this ear is gone, so the person can fall down. That is known as Tumunkin's crisis. We need to learn this. Tumunkin's crisis, falling down without unconsciousness. Next. The patient sometimes can get diarrhea during this episode. Next. The tinnitus persists in between 2 episodes. The tinnitus, that is the ringing of the ear, it can persist between the 2 episodes. In a mall or place where there is always loud sounds, the patient hears loud sounds even more. And this phenomenon is known as recruitment phenomenon. We need to take care of this as well. The recruitment phenomenon is what? The patient hears loud sounds more. Next. That is, it causes the dislike for noisy environment. Moving on, we have this patient can get vertigo on heavy loud sounds. That is known as Tullio's phenomenon. Tullio's phenomenon. Hence, we got this 3: Tumunkin crisis, recruitment phenomenon, and Tullion's phenomenon. Moving on, this patient can get same sound in 2 different frequencies, that is diplacusis. 2 different frequencies, the patient can hear the same sound. Just imagine the confusion of the patient. Diplacusis. Now, as in Hindi movies and all, a few years later, kuch salo baad, when time passes on, there is cochlear damage. The cochlear damage starts. Okay? It's like a few years later. Now, hearing loss in between episodes. Earlier, what did we see? There was tinnitus. Okay? Tinnitus can persist between 2 episodes. It was tinnitus persisting between the episodes. Now, there is hearing loss between episodes. The patient will complain कि मुझे कुछ सुनाई नहीं देता है. So, that is called the fluctuating hearing loss. On to the investigation part. The pure tone audiometry shows low frequency SNHL in early stages. This graph can be of importance. The graph shows rising audiogram, that is the pure tone audiometry graph. This can be an image-based type question also. The special investigation to diagnose it is electrocochleography. Next, we come to treatment. Now, treatment, since there is vertigo, we give anti-vertigo drugs, and then we give acetazolamide in between episodes. If there is no improvement, then we move on to surgery. The name of the surgery is endolymphatic sac decompression surgery. This is basically Donaldon's line we need to search for, that is a surgical landmark for the this endolymphatic sac. So this can be like, which is the surgical landmark for endolymphatic sac decompression surgery, that is the Donaldson's line. Next, we move on to transtympanic injection of gentamicin. That is chemical ablation of the inner ear that kills the inner